Hello and welcome to The Drum. I'm Ellen Fanning. Coming up, freedom for regional Victoria and financial relief for lockdown Melbourne, but conditions apply. No jab, no pay. Growing calls for mandating vaccination of high-risk workers. But is hesitancy the real barrier to full coverage? And you only live once. After the devastation wrought by the pandemic, more and more people are refusing to do the dirty work. Joining me on the panel tonight, Vice President of the New South Wales Liberal Division and President of the New South Wales Liberal Women's Council, Mary Lou Jarvis. Lovely to meet you.
Hi.
In Canberra tonight, Acting CEO of the Australian Chamber of Commerce and Industry, Jenny Lambert. Hi, Jenny.
Hi, Ellen. Great to see you.
In lockdown in Melbourne, infectious diseases specialist at the DOHERTY Institute, Kudzai Kanhutu. How have you survived the day?
Not bad. I avoided some homeschooling, so not bad at all.
That's a win. And in Adelaide tonight, lawyer Corinne Grant. Hi, Corinne. Good to see you as ever.
Good to see you too, Ellen.
And you can join us on Twitter using the hashtag The Drum, and we're on Facebook. Well, tonight we should have been tipping our hats to Melburnians as they emerge from yet another week of lockdown, but unfortunately they are only halfway through this latest ordeal. Regional Victoria will come out of lockdown at midnight tonight with some restrictions, but Greater Melbourne will remain locked down for another week. Just 3 cases of community transmission were recorded in the last 24 hours, and all of them were already self-isolating.
The advice from Public Health has been we need a further 7 days in Melbourne to chase this down to the end, to follow this outbreak, because we cannot afford to let this outbreak let loose in Victoria and beyond our state borders. We've got to drive this to ground.
So that's the strategy, but there's growing concern that the same is happening for Victorian businesses and vulnerable workers. James Molino says the solutions rest with the federal government.
There's a lot of things we're waiting for when it comes to the Morrison government. We're waiting for a definitive decision on alternative quarantine. We're waiting on whether they're going to support Victorian workers or not. We're waiting on more supply of the vaccine. There's a lot of things that we're waiting for. But the point I'd make, the only way out of this pandemic is the successful rollout of the vaccine.
And this afternoon, help was announced, albeit with strict criteria.
That will be a payment of $500 for those who would ordinarily work more than 20 hours in a week, and $325 for those who would work less than 20 hours a week. The person will not be required to use annual leave, but must have sufficient and must have insufficient other appropriate leave entitlements. The person self-declares that they have liquid assets of less than $10,000. Remember, we're talking about someone getting through the next week.
OK, Jenny, you did tell them so, didn't you?
Oh, it's certainly been an issue ongoing for us ever since, even before JobKeeper finished, that some ongoing targeted support to businesses was going to have to be put in place when government restrictions apply. The issue here in terms of local lockdowns in a particular state is where does the federal government kick in and on what basis? And I think that's been, the big issue in consideration of what's now been announced today. OK, so thinking back, JobKeeper was paid through the employer at $750 a week in its first iteration, and this is $500 a week for full-time employers. Wasn't paid for the first week, and there are restricted numbers of people who can apply for it. It's a third below the minimum wage, says the ACTU, half the standard disaster relief payment, and doesn't secure their employment. What do you think of it then? I think it's a good beginning. I think one of the issues here is how long these lockdowns occur and whether this scheme is the beginning of a discussion about when there are even longer lockdowns. When we're talking about only a week, it is a question, or only a week or 2 weeks, it's a question of getting workers through, helping businesses to get through, and certainly a contribution from both levels of government. The issue is what we put in place for the longer term here, because this will continue to happen from time to time, and we need to make sure there's greater certainty about what's going to happen from both the state government and the federal government.
Yeah, and go on.
The other important thing is that it's, the federal government can't put on the table, what we'd call a blank cheque to say, look, we need to fund, regardless of what the state government's response, we need to fully fund it or to even part fund it. There has to be some incentive for the government response at the state level to be proportionate and targeted. And that's been really one of the biggest issues for the National Cabinet to consider, is how do we get a more national approach to this?
Corinne, it's interesting, isn't it? Jenny's had a meeting today with Prime Minister and Cabinet. These are the discussions that are had. You have to support people. And Aki's been very much on record as saying you're going to have something in the place of JobKeeper. But you can hear the concern that's there is you don't want to create an incentive for state governments to be overly cautious. What do you think of that?
I think that's going back to what a number of federal government politicians have said today, including Andrew Bragg, who was on afternoon briefing just a little while ago, was there is this concern from the federal government that states enter lockdowns because they think it's politically good business for them. I mean, that's bonkers. I think especially Andrew Bragg was getting lockdowns conflated with shutting down borders. No state is locking down their businesses, stopping people from working, creating a greater deficit for themselves, thinking that that's going to win them votes, especially in Victoria. The cupboard's bare in Victoria. Everybody, businesses, casual workers, full-time employed people, all of the savings they had, they've eaten into in the last lockdown last year. So I don't think giving them any money now is going to disincentivise them from working. It's just going to help them keep a roof over their heads and hopefully some food in the cupboard. Yeah,
and what's your experience? You've now moved to Adelaide, so you've avoided this, I'm sure that's not why you moved, you've avoided this latest lockdown. But what are you hearing and seeing from friends back in Melbourne about how they're surviving and enduring this?
Well, anecdotally, I have 3 friends whose businesses have closed already, and I know that there are others who are completely, they've worn through the seat of their pants already. This lockdown could be the end of them as well. Every lockdown is going to lead to more people losing their jobs. And then you've got people in really insecure work, such as artists and performers. An entire festival had to be, the Rising Festival was shut down after being open for one day. And that's a lot of people out of work now. $500. It's not even. It doesn't cover 1 week's rent in Melbourne. If you're a casual worker, you don't have $500 sitting in your bank account anymore because you've already blown it all last year. People are in trouble.
And so those 3 friends who had their businesses closed down, just quickly, what businesses do they run?
Hospitality, cafes and bars.
Kudzai, would we be here if the vaccination rollout was quicker, or is this just what happens in a pandemic when you're not fully vaccinated?
In the context of the bigger public health picture, I think it's really important to acknowledge that it's an exercise in multi-agency risk. So the risk is owned across the chain, and when things fall apart, it's usually part of that, Swiss cheese model. So we start with the individuals themselves, people who perhaps run well and were unaware and passed it on to someone else, through to the formalised measures that we put in place, like hotel quarantine, vaccination. So when you view it like that, you can only own the amount of risk that you actually have control over. So of course it's really important that we move ahead with the vaccination campaign, but it's equally important that we don't lose sight of the bigger picture of all of the things that need to be right in order for us to actually reach a point where we feel like we have a measure of control over what happens next.
So is vaccination where it needs to be, Kudzai?
I think we all would want it to be further ahead and for things to move forward quickly, particularly for those of us who work in healthcare. I myself work in the aged care sector as well. I do aged care visits, and I've really been pained by their stories of not feeling like they've had sufficient support to get vaccinated. So I think absolutely in the scheme of things, you want every single pillar of that public health defence to be robust and to be moving as quickly and as efficiently as possible, so that people don't feel this deep sense of angst or don't endure repeated periods of either lockdowns that are affecting people on numerous levels, and not just, personally, physically, psychologically, and in some cases culminating in business losses or just, long-term permanent unemployment or distress and trauma.
It's interesting, isn't it, Jenny? You see the Victorians stand up every day, and they're really giving it to Mary Lou. They're really giving it to people straight, Mary Lou. They're sort of saying, we're in a race with this virus. The virus doesn't sleep. We've got to get vaccinated. Let's go, let's go. And the Prime Minister's saying today, we don't need to fear this, and repeatedly saying it's not a race. There's two different messages there.
Yes, but I think, Ellen, the real thing is the comparison of how we've been able to manage it in New South Wales, which is my state, and what's happening. I mean, you've got to feel for the Victorians. The fourth lockdown, and it was 144 days. I mean, the people down there are basically in a crisis situation, and yet, you can throw more money at it, you can throw more vaccines. As I understand it, per capita, Victorians have had more money flow from the federal government than any other state. And throughout COVID, something like $45 billion has flowed to Victoria. I mean, the reality is the ideal situation is we don't want lockdowns. We want to have a process in place that is managing the pandemic.
And Molino's saying there in that introductory comments that we played to this segment, vaccination is the answer. And yet the consistent comments, again from the Prime Minister today, we don't need to fear this and it isn't a race.
Well, I think it's about calm and measured approaches to these things. If we all panic and we get fearful, it's all going to fall in a heap.
But those comments are not about fear. The race comments aren't about fear, they're about speed.
Yeah, and I think the fact of the matter is the vaccination rate has sped up incredibly. In the last 10 days, we've had 1 million people vaccinated. I'm one of those people that had it this week, and it was. I just want to say what an amazing job the healthcare workers are doing in the way they're operating the vaccinations. There was Lisa and Deirdre that looked after me at Westmead Hospital this week. It was smooth. It all went to plan. It was in and out in half an hour. I don't know what's happening in Victoria that this doesn't seem to be able to be the case, where I'm hearing people cannot get the vaccination. It seems to me that is it a case of the management of the aged care homes themselves, or is it an issue with the healthcare workers working in the Victorian government, or is it some other issue?
I think the issue, wasn't it, Kudzai's federal government supply. There was a predictable uptick in the number of Victorians who wanted to be vaccinated. There are vaccines somewhere, but they're not in Victoria, and we've had GPs screaming out, look,
well, I've
gone. Well, let me ask, Kudzai.
Look, there are a few things that have been, assessed as being the cause of some of the hurdles, and some of them are just supply and demand issues. So a sudden uptick, a lockdown, and then people who decided, look, I've actually got a moment in time where I can get vaccinated. And I don't think anybody would have predicted that to happen at this juncture in time. So in Victoria, there are a few peculiar factors that have led to us being in the situation we're in. But if you look at the expanse of time, there have been numerous opportunities for interventions to, I guess, change the trajectory, and we find ourselves in that moment right now. So I think it's so important for us to remember that even if we look at contact tracing and testing, there are resource implications behind that as well, and to make sure that this is probably a dress rehearsal for a future pandemic, a future event. And if we keep that in mind, I think it allows us to be a lot more pragmatic and actually constructive in the debates we have around why things are not working, so that when the time comes, we can do things like have surge capacity to support high-risk workers in a new industry in future pandemics, to get them vaccinated quickly, rather than finding ourselves in this sort of misery loop where we're arguing with each other about why things haven't happened. What are we doing and what are we seeing that is going to be put in place that will put us in a better position in 2 weeks from now, in a month from now, or in 5 years from now, or 10 years when the next pandemic rolls around?
Yeah, and Jenny, on that note, the Victorian proposal for a 500-bed quarantine facility, unlike hotel quarantine that is purpose-built with, separate accommodations. The one in Howard Springs, you have your own little hut and you have a little balcony to the front of it so that you're not sharing air with other people. You don't have that aerosol transmission. The feds have said, yep, $200 million they'll supply for that, and they've signed an agreement for that. That's 500 beds. How much of a dent does that make in what Kudzai's talking about in terms of building up our capacity to deal with this in an ongoing way?
I mean, it's a very important announcement, and it's very welcome. I mean, there are a lot of people been calling for this for a long while, but it is only going to make a small dent. We've got to be aware it's a very good mechanism, at least to deal with very high risk returning travellers. So that's fantastic. But I think it comes back to Gupta's very important point about the Swiss cheese model here, and it comes back to collective responsibility of a range of things, of which purpose-built quarantine, vaccination rollout, contact tracing, the way that we're dealing with, encouraging people to be vaccinated, the communication strategy behind it, all of these things, the way we deal with hotel quarantine, all of these things are layers of trying to manage the risk. And it's collective. We all have our part to play, including those of us that have lined up for the jabs. So it hasn't been, what I've really found very sad in the last couple of weeks is the extent to which we've become very partisan in the public discourse about whose fault it is. Whereas it's really something we need to move on past that point and say, look, it's all of our responsibility to try and do our bit to fix this and help get over these problems, because unfortunately at the moment, the businesses who are shut down and the employees who've been stood down don't really care about the discussion of whose fault it is. What they want is to have some support given to them to help them through, and also that they feel that governments are working together on fixing the problem, not blaming each other, because that hasn't at all been helpful.
Well, amidst the anger over how few aged care workers have been vaccinated, there's an ongoing discussion about whether it should just be made mandatory. There is a precedent for this. In April, the Fair Work Commission upheld the sacking of 2 workers, one from a childcare centre, the other in aged care, for refusing a flu vaccine, which was required under a state government public health order. Now, Queensland is the only state so far to require its frontline COVID workers to be vaccinated. Some states require hotel quarantine workers to be vaccinated. But for now, the Fair Work Ombudsman says that employers should assume they can't require their employees to be vaccinated, but that could soon change.
In relation to mandating for aged care workers, that had been previously looked at by the Chief Health Officers of the states along with the Commonwealth, and the Prime Minister and myself have asked the medical expert panel to review that decision. That was not recommended at the time, and we have asked the medical expert panel to review precisely that question.
For more on this, we're joined in Adelaide by Chief Advocate for National Seniors Australia, Ian Henschke. G'day, Ian.
Hello, Ellen.
It depends how you look at it and who you listen to as to whether or not the vaccine rollout is going well or it's not going well. If you're advocating making it mandatory for healthcare workers, you must think someone somewhere needs a kick in the pants.
Well, I think we need to just think about what happened in a country that's very close to Australia, and that's Italy. They've got a little over double the population of Australia. 3 million of them got the virus, and more than 110,000 died. They made the decision to make it mandatory for health workers to have the vaccine, and they had 1 in 10,000 of them reject the mandatory move. So, I mean, but what's the difference? Maybe we're living in a fool's paradise here, and where you've got a situation where everybody knows someone that's either got the disease or died from it, we have a different focus of our minds. It's interesting, isn't it, Ellen, because Australia at one stage was sort of changing governments at an Italian rate, so maybe we should actually have a look at Italy and look to them for the answer. But look, to be serious about it, Italy was one of the countries that had the most vicious outbreak, the most deadly outbreak at the very beginning. You might remember that because they had a connection with the region of China through the leather goods, I think, in the north of Italy. And my wife's Italian and of Italian background, first generation, and we sat and watched a lot of those reports. And I think one was by an ABC foreign correspondent program where we saw that the health workers there were dying, and we also saw fit young people getting it and dying as well. So the Italians are much more focused on what it can do, and I think here in Australia we're having a discussion about, oh, I'd rather wait for the Pfizer, or you know, perhaps we should have the option. And I mean, we can afford to do that possibly, but if this vaccine isn't rolled out and it breaks out, then I don't think we can even discuss the option of mandatory or not.
Okay, Kudzai, can I turn to you on this question? I mean, as I say, mandatory suggests somebody needs a kick in the pants. Whose backside would we be kicking by making it mandatory for health workers and aged care workers to have a vaccine? Would it be the federal government who's supplying the vaccine and dealing with issues of getting it to aged care workers, or would it be the aged care and health care workers themselves?
Well, it's a shared responsibility and a right. I think after we saw the 655 deaths in aged care last year, it would be hard to argue that aged care facilities aren't healthcare environments. They very much are, and people who work in them acknowledge that. It's hard, heavy-duty healthcare work. And there are already precedents for this. So there are many workplaces, including mine, where you really are mandated essentially to have a certain series of vaccinations. So it's not new territory. In terms of kicking people up the pants, I don't think anybody needs to be kicked. And there are many healthcare workers and aged care workers who would be very happy to subject to mandatory vaccination, but only with the understanding that we would make it really easy for them to get that vaccination, that we wouldn't make it challenging for them, and there would be supply and ready accessibility for them so that it's not a challenge. And that's sort of the shared responsibility of that social contract, that they're doing things to their bodies that may carry a small amount of risk, but within the context of the really high risk of passing on an infection that can kill people and at high rates in the elderly population.
Ian, I mean, just come right down to it. I mean, the problem does not seem to be willingness, despite the woeful numbers of aged care staff, in fact, the unknown numbers of aged care staff who have had the vaccine, because even though they were listed as a priority group to get the vaccine, there was no process to ensure they were prioritised, and there was no way to record whether or not they had had their vaccine. So much for priorities. But one way that they could get a vaccine was if there were any leftover needles hanging around in the aged care setting after the residents had been vaccinated. And 30,000 aged care staff who had the opportunity to get those leftover vaccines happily got them. You know,
yes.
Come and get me. God help them if they'd got their first vaccine when the residents had got the second vaccine, because then the advice to them was, good luck finding the one you need in 3 weeks or 3 months. Go out and hunt and gather like everybody else. Pay the $18 in parking, take 2 hours off work, even though you're a shift worker on low wages. So is there really a problem with getting aged care workers to get the vaccine, or is the problem that they can't get it?
Look, I think we heard someone talking about a shared responsibility before. I noticed this afternoon that the Chief Health Officer in South Australia, Professor Nicola Spurrier, has said that she's going to get enough Pfizer vaccine to give aged care workers the Pfizer, because you can get the second jab within, I think, 3 weeks. So why is a health official in South Australia suddenly doing that?
Well, the Victorians are doing it, and the Queenslanders are doing it, and the South Australians are doing it. Whereas it was a federal government responsibility. Now the states have taken that over and said, quick, we've got to get these aged care workers done.
Well, I think it's really crucial that we recognise that we're lucky in the sense that we haven't had a massive outbreak, and perhaps the best thing about this outbreak in Victoria is that it has focused people's minds. The fact that people are now realising what could happen. And I go back to that again. If you look at what happened in places like Italy, and if you look at what happened in Brazil and the Philippines, what's been happening in India, we are no different. We are made of the same, 46 chromosomes or whatever it is, and it's going to affect us the same way. So the mere fact that we're an island and we can even sit around on an afternoon like this as we head into winter discussing whether or not we should and which one's better. I mean, it shows that we're in a bit of a fool's paradise, and it is time to actually just address the issue and say that, just like the flu vaccine, we are going to make sure that all our workers that work in healthcare and all our aged care workers that work in aged care are going to have that vaccine. I spoke to a doctor and a nurse yesterday, and both of them said, as far as they are concerned, it's a no-brainer.
OK, Corinne, put your law hat on, your mortarboard hat on. The Fair Work Commission ruled that when there was a public health order issued in New South Wales to say at the beginning of COVID, all aged care workers have to have the flu vax, right? They put that out, and if you're a visitor, you've got to have the flu vax as well, and somebody didn't want to, and they took it to the Fair Work Commission, and the Fair Work Commission ruled that it was reasonable and prudent for the aged care provider to have sacked that person because they had an obligation to fulfil the public health order. So, therefore, do you think it would be legal, more broadly, to say, OK, all of yous working in healthcare and aged care, you got to go do it?
I haven't read the judgment on that case in particular, but there's a particular phrase that's used when you're talking about dismissing people, and that's not being able to fulfil the inherent requirements of the job. And my understanding in that case is one of those inherent requirements was to be immunised so that you didn't infect people who are immunocompromised. So people in aged care settings are immunocompromised because of their age, because of underlying health conditions, and because they get sick. People in hospitals are in the same position. So that's a really bright line type of case in those situations, that if you're going to work in those areas, it is reasonable, and that's using the Fair Work Commission Ombudsman's language, it is reasonable that you should be vaccinated in order to protect vulnerable people. So I would say that those cases, it probably is fairly cut and dry, that you should be vaccinated if you work in an aged care facility, whether you are a healthcare worker or whether you are the chef or the person who is handing the tray of food to the resident, or you are the person who is washing the resident. You are very close to people who are immunocompromised. Where it starts getting a little bit fuzzier around the edges is when you start talking about where else it might be reasonable to be vaccinated in order to protect others. For example, childcare facilities. Children can't get vaccinated. We know they have a lower rate of getting infected, but they can't be vaccinated. So should childcare workers all be vaccinated in order to protect children? Who knows? I wouldn't want to be the employer or the employee who has to test that one before the Fair Work Commission.
Kudzai, there is an argument. Sorry, Jenny, just let me go to Kudzai real quick. Is there an argument to say, well, you're trying to get to 80% of the population to be immunised, and that's a higher percentage of adults because kids aren't going to be immunised, and so you really have to do whatever you have to do to get to that number, because you've got to make room for the children, for the pregnant women, and for those who have some medical or religious or whatever reason that they really, really, really can't get vaccinated. And don't all the studies show, Kudzai, that, you know, in the US, if you say that to healthcare workers, if you give them incentives, you get to about 62%. You get to this ceiling, and then once you say it's mandatory to workers in hospitals, bingo, you're up to 98%. And that's that mandatory, making it mandatory, that gets you all the way through, and they're for people who are medically trained.
Yeah, absolutely. There's always a sort of a ceiling if you're giving people options, and once, and it's across the board with other policy frames as well. You know, if you look at gender equity on boards, etc., once you set mandatory sort of standards or levels, people will up their game. But I think for people in healthcare sector and in aged care, there's also a personal incentive. If I'm an aged care worker, I don't want to get COVID at work and take it home or get sick myself. So making it mandatory within these sorts of contexts is actually quite an easy sell. There will be a small minority of people, for whatever reason, who actually can't get vaccinated, and then, you know, concessions are made for that very, very small minority of people. But as a general rule, I don't anticipate for COVID in particular that you'd have swathes of people, if we set a sort of mandatory requirement, who would turn away and say, absolutely not, I don't want to have this done, because it's a personal risk, and it's also a risk to the people that they work with and relate with outside of work as well.
And again, Jenny, we're just talking about these, as Corinne said, these aged care settings at the moment. We're not talking about making it mandatory for the whole population. if there was a rule that aged care workers had to be vaccinated, in the end, doesn't that just make it a commercial problem for the aged care provider who has to get their staff vaccinated? That instead of the federal government or the state government or whomever, suddenly it's the aged care provider who's got to sort out the supply of the vaccine, when they're going to get the second one, time off to get it, make sure they don't have, as I did, an $18 parking fee, which I could pay. I had 2 hours off work, that's fine. I'm not working shift work for minimum wages. So suddenly it becomes the provider's problem.
Well, certainly that is a risk, but I think the biggest issue here is coming back to, is there sufficient supply for the government to guarantee that the aged care workforce can get the vaccine when if they mandate it. The other really important thing is the employers shouldn't be required to mandate it. It's about public health orders that drive. So the examples you gave, we need to be clear that the government's mandated it through public health orders and employers need to enforce it. And I know that when we looked at this in detail in January, both the unions and ourselves and other key stakeholders here, the big issue was around supply and also the nature of aged care versus the nature of something like a public health system where it's mandated there and potentially employees who for various reasons may not want to get it or cannot get it, they can be moved elsewhere. In aged care, that's very rarely the case. And so it is a very blunt decision for an employee that is hesitant. But I agree, most employees would fully embrace it. So, I mean, the key things that we consider is mandating should only occur through government order, and then only when there is sufficient supply to make sure that can be rolled out in a way that makes sure that, as you say, establishments and workers don't have to be inconvenienced.
Merida?
Yeah, well, look, I hear what you're saying, but really, to Corinne's point, there has actually been a Fair Work Commission decision in relation to a childcare worker who refused a flu jab, and that was found to be a lawful and reasonable direction. So it is actually open.
COVID, though, it's different.
No, I know, but if you take the only instance that we've got really in the pre-pandemic world is in relation to flu vaccines, and it's of course common that to go into an aged care facility you've had to have the flu vaccine before you can visit your parents or your grandparents. It seems to me that in terms of the environments that we've got to remember that aged care is run at a number of different levels, at a government level, but also in the private sector, and it probably needs to be the people best placed to manage that within the facilities, in my view, are the aged care facilities. Now, you can come over the top and mandate it, but I think the problem with that, we actually live in a free society. The whole point about the vaccine, I
can't leave the country.
Well, you can choose, though, Ellen, to whether you have the vaccine or not. And I think you've got to remember that there are some people, because of various health situations, that they can't. To one lady that I know that's in an aged care facility that caused all the problems in Victoria, she's got a number of health issues, which means she can't have the vaccine. Her husband, who's 93, has had the vaccine, and basically she's in a situation because of lockdown that they can't even see their families. I mean, I would have thought it's fair and reasonable to say that within the environment that you go into, you can actually have the people that are caring for you deciding that.
Ian, do you reckon that we're underestimating the amount of hesitancy there is in the community about this? I mean, there's maybe a federal election brewing. Do you reckon politicians on either side would be saying, let's mandate it, let's let that message get out, and all anyone will hear is mandate and vaccine, and there's 30 or 40% of people who aren't real fussed on the idea. Who's going to stick their hand up for that, do you reckon?
Well, I think this is a very interesting point because you raised that issue of whether or not a politician's going to take the bold step to lead the country. And it's very interesting, isn't it? Because I've seen Labor sort of dilly-dally, shilly-shally around the issue of mandated vaccines. We've seen the government do it. What we need is probably a unified approach so that it's not political. Perhaps they could get together and have an agreement to not attack each other over this.
You're even trying not to laugh as you say that, Ian.
Well, yeah.
Well, look, face.
I mean,
really trying.
If you're in an election year and they think they're going to lose some votes, I had someone tell me today that they were talking to someone who was in the Liberal Party who said that they were against mandating it because they were worried that there was, I think it was 20%, they said, of aged care workers who didn't want to have the vaccine. And they said that the they thought that they would walk out and walk off the job, and then there would be an issue. So
there's a concern about underemployment.
I mean, if that's true, I think that's a real worry. But I get back to the point, we should remember that we're having all this discussion because we haven't got people dying. I mean, I would have thought if we were having this discussion last year, I think mandating wouldn't be an issue. I think we would be in the middle of those people that were dying. We would have done it. The reason we do the flu is because we know the flu kills. The reason we would do COVID, because we know COVID kills. So I think we should just get on with it and mandate that the vaccine should be mandated in aged care and healthcare. Thanks so much for joining us, Ian. Thank you. Ian Henschke, the Chief Advocate for National Seniors Australia. A smile or a simple hello can mean all the difference to people sleeping rough. So when Joshua Coombs began offering haircuts on the streets of London, it was not only transformative for the strangers he met, but also for the former hairdresser himself. Those he spoke to shared their joy, their hardships and their loss, and with their permission, Joshua shared their images online. And it started a global movement, Do Something for Nothing. And since then, he's featured some of those he met in a new book of the same name. Joshua Coombs spoke to the drum's Stephanie Bolci.
That's the bollocks, man, honest to God.
I was working in a salon at the time, and this was my job. This is what I did, but that all changed for me one day when I offered someone a haircut who was in a difficult position, and I began to listen to those stories of the people I've met. And I was never really into that how's the weather, where are you going on your holidays, chit chat. You're close and up close and personal with people in a way that I was used to in the salon, but obviously on the street that is quite different because people are living in the elements, they're living outside. People are washing themselves in public bathrooms. They're trying to catch a shower where they can when they stay inside a hostel. You know, things like dry shampoo, when I take it out, I use that. You know, facial wipes and hand sanitizer and all the rest of it. I don't even think about it. My approach is always one of just seeing how the day goes, and sometimes people are in a worse condition than others, and I try my best to kind of make people feel looked after in that moment. And I just think, what would I want? The pandemic came along and you know, it made things a lot worse for people who are in an already vulnerable place. We can all relate now to what it's like to be isolated and away from our loved ones, and to feel a lack of those basic human connections. You know, a lot of these cities that we live in turn into ghost towns.
It's just, when walking past, no one wants to talk to you, do they really, in case you've got it?
So Levine's someone who I met in London a couple of years ago now. She was there sitting down with her dog, Misty, and I recognised her, and I used to know her boyfriend, Nick, who lived on the street also, who unfortunately passed away. You know, I met up with her recently and I gave her her copy of the book.
I feel proud as well that I'm actually in it, and yeah.
And we're going to try and do whatever we can to support her further. Like, look, 5% of Australians who were living on the street died in 2020, and the stats are quite similar here in the UK. Like, we don't want to live in cities and towns where people are dying on the street, do we? I mean, let's try and remove like the misconceptions and try and listen. I think to pile on more judgment and you know, how we believe someone's life is going from the outside and judge somebody based on that, it's not going to help.
When you smile at someone, they can't help but smile back. And then as they walk away, they think about that smile.
Being able to just be acknowledged as a human, being able to be recognised, first of all, is really fundamental for all of us.
If we are to find a sliver of good news among the bad at the moment, vaccination rates are climbing with record numbers in Victoria over the last week. But for Victoria's acting Premier, it's just not happening quickly enough.
The virus is our enemy, and the virus doesn't sleep. The virus mutates. The virus thinks that this is a race. Only 2% of our population is fully vaccinated. Only 2%. Only 2 out of 10 people have received their first vaccine. There are countries around the world where they've got fully vaccinated populations well over 50%.
But what happens once we reach a similar vaccination rate here? Do the outbreaks stop happening? Do we stop locking down entire states? Well, to find out, we need only look to the experience of the UK. They spent much of the first part of this year in lockdown, but have been gradually opening up over the last few months. And with almost half the country fully vaccinated, much of the UK is set to lift final COVID restrictions in just over 2 weeks. But that could all now be at risk. The Drum's Ruby Cornish has more.
On Tuesday, for the first time since March last year, no new COVID deaths were recorded in the United Kingdom. The modest milestone is a glimmer of good news against a seemingly encouraging backdrop. The nation boasts one of the world's highest vaccination rates. More than 29 million people have had both doses of a vaccine. 39 million have had at least one.
I can confirm that we now have given a first dose of vaccine to 3/4 of the adult population of the United Kingdom.
Each day, about 520,000 doses go into arms, well above Australia's one-day record of just over 140,000.
The more people vaccinated, the better, so doing our part, really.
Yeah, I just wanted to make sure that I'm staying safe and I don't risk spreading it to people.
And unlike Australia, targets are being reached. In England and Scotland, everyone over 30 is now eligible for a jab. In Northern Ireland and Wales, it's everyone over 18. Despite all this, in the past fortnight, case numbers have gradually been climbing again, and most of those new infections are the notoriously contagious Indian variant. Restrictions are due to be lifted in less than 3 weeks on the 21st of June. But experts are warning that could be a risky move and say the UK is slowly heading into a third wave.
The numbers of cases are still relatively low at the moment, but of course all waves start with low numbers of cases and that grumble in the background and then sort of become explosive. So the key here is that what we're seeing is the signs of an early wave that will probably take longer than previous waves to emerge because of the fact that we do have quite high levels of vaccination in the population. So there may be a false sense of security for some time.
Vaccination is not the only issue. You have to have vaccination in place and keep the numbers under control. Otherwise, it could go rife again.
The government says it will hold off making a decision about restrictions until it has a clearer picture.
What we need to work out is to what extent the vaccination programme has protected enough of us, particularly the elderly and vulnerable, against a new surge.
Kudzai, can I start with you? That's a really interesting question about how does this end? On the one hand, in the UK, they're saying, well, heck, we're getting to the point where enough people have been vaccinated, particularly the over 50s, who are the ones who are likely to end up in hospital. So probably we're getting to the point where the health and hospital system won't be overwhelmed. That could be a benchmark for opening up. And then we heard Professor Gupta there say, careful about a false sense of security from the vaccine. I thought the vaccine was supposed to give you a sense of security.
All of these things, or these evolutions that we've had along the way, I think you'd be best to consider them as milestones in what will be a continuum, a very, very long journey. And I would be hesitant for people to sort of speak in terms of an end. All we are in at the moment is an endless journey of discovery, and I think that's the
Why
beauty
are you
of science.
making it sound great? An endless journey of scientific discovery. It's a horrible pandemic.
You know, if we think about the sorts of highlights of this pandemic, such as the ability to produce a vaccine in a year, that is the result of decades, if not centuries, of work that came before, of people who decided not to pull up stumps and to continue to work on basic science and research. So when I speak about that joy of discovery, it's the fact that scientists don't give up. They don't just decide one day they've done enough, they've learnt enough. And I think we've seen enough from the failings of the responses to the pandemic early to things that are happening right now that speak to this staying alive in that spirit of discovery and wanting to continue to do better, so that each time this happens in future, we'll be better placed. So there are definitely milestones, and there'll be people who have had things that they're waiting for desperately, whether it's the first holiday or a wedding that they've waited for. And of course, we have to make space for celebration and to mark important milestones and ends. But that scientific journey and the healthcare journey is never ending, and that's a good thing, that we should always be seeking and striving to do more and to do better.
Corinne, I remember going to the movies in San Francisco before catching a flight home, and the movie was called Last Man Standing with Bruce Willis. And my Aussie friend said sarcastically to me in the queue, "I wonder how this ends." And the American behind us went, "Oh, you've gone and ruined it for us." We generally know how things end, but I guess to some extent we have to decide when we're going to relax, when the vaccination rates are high enough, and when we're going to drop our guard.
I think comparing us to the UK probably isn't a great analogy, because the UK has had really high levels of contagion the whole way through, and despite that, residents of the UK have been relatively relaxed and have gone about their business far more than what, say, Victorians have. And I've had the good fortune to be in Victoria, Adelaide and Perth. And over the last few weeks, I was in Adelaide and Perth when the Victorian lockdown happened. Victorians are used to it. Adelaide and Perth have got away with it pretty much unscathed. As soon as Victoria locked down again, everyone in Adelaide and Perth started socially distancing, started wearing masks again, started using their QR codes, using the clean pen, putting it in the used pen little container over on the other side. Everyone became very compliant all over again. We fear the unknown. Most of Australia hasn't been living with the virus in the same way that Victoria has. So I'm not sure that once we get to a critical level of vaccine take-up, that complacency will creep in. I think any little spark anywhere around the country, everyone will just go like little frozen mice again, bury themselves and wait for it all to be over. I don't think we'll relax that easily. So when will it end? Who knows?
Mary Lou?
Well, look, I think, coming from New South Wales and admittedly living in South Australia and Victoria, I mean, we are fairly relaxed. I was able last night to go out to a comedy show to support Camp Quality with 100 people. We got the QR code. We were perhaps not as socially distanced as we would normally be, but the reality is that we've managed it so well in New South Wales. It's sort of like, why can't the rest of Australia act in this way in terms of the way it's been managed? And I think, to the point earlier about what's happening in the rest of the world, how lucky are we to be in Australia? I mean, 910 deaths is an absolute tragedy for those people and their families. But in comparison, when you think that if we'd been in the same state as the rest of the OECD countries in the way they've managed the pandemic, 35,000 of us would be dead. I mean, it's really something we've got to be incredibly grateful for. You could say it's a product of the fact that we're an island, but also, I think it was really a credit to all the governments around Australia that they all got together in this national cabinet and looked at as to how they could work together, and they're sharing the best practice. And I just wish in Victoria, I don't mean to be partisan, but why couldn't Victoria get their QR codes up like we have so that the contact tracing can be dealt with? I mean, I had a friend that came up from Victoria last week and she was aghast at the fact that we have these QR codes. We just do it as like coming in here tonight. We do it everywhere. If there's an issue and an outbreak in New South Wales, the barbecue man showed that in the same sort of analogy to what's happening in Victoria, it can be managed.
Yeah, I mean, I don't want to get off into that discussion, but they were two very different outbreaks. You had a super spreader who'd come out of South Australian federal quarantine into Victoria, and happily, barbecue man was a middle-aged person who went to barbecue shops, not somebody who...
But we had the Crossroads truckie or something.
Let me go to you, Jenny. Pandemics are a social phenomenon, right? There's going to be a public health end to it when we get Kudzai on and go, OK, can we open the borders now? Can we... we're going to have to continue to do all these various things that we're doing, but there's a point at which we say, OK, let it in because we're sufficiently vaccinated. But that's not the social end to it. That's what Corinne's talking about. I mean, is there a possibility that Australians will still want closed borders even after there's a consensus that the public health risk is passed? And how do you overcome that?
Well, I think you've got to overcome it by working in stages. So rather than focusing on what the end looked like, we need to focus on what next week looks like, next month looks like, what's going to happen when half of us are vaccinated, what's going to happen when most of the adult population is vaccinated, and then consider what is the stages that can, what does that look like in terms of social distancing, what does it look like in terms of freedom of movement and travel, what does it look like in terms of our international borders, and actually try and focus on the step, because if we don't focus on the steps to the end, and only try and conceptualise the end, we could turn ourselves around in knots, even as UK has done, because they've set a date for the end and then realise, oh, maybe that date's not as useful. So I think all we can do is have the steps along the way and try and test the action that we take. Is that working? Is it keeping the community safe? Is the community happy to move to the next step? All of those things. That's what we'd like to focus on, is what is the plan along the way to the end, rather than focusing on what the end looks like.
OK, that's very interesting, because that's what Victoria did. Remember, during that enormous lockdown, these were the milestones. They didn't have dates attached, but that they were descriptors, and you could sort of figure out, are we at this point that is described here? You had a meeting, just quickly, Jenny, with PM&C today about the release of international plan for the borders reopening. Did they wholesomely embrace that idea of yours? Are steps coming out tomorrow?
No, I think the government has in all its public pronouncements, particularly I suppose before the budget and hopefully a little bit to come, have been talking about a stage plan. We're still waiting to see what those stages look like. Obviously, it's quite a complex area that's working through with National Cabinet. We've certainly been encouraged by the fact that there's going to be movement in a range of areas, but there's much more to be done, I think, in terms of getting all the governments as much as possible on the same page and being very clear. Businesses all the way through, we've been saying the same thing right from March last year, is what's needed most importantly is certainty, much greater certainty as to what the next step is.
There is no certainty, and this is the issue, isn't it?
Kudzai, how does it work if you look at Ebola, if you look at HIV? Can we learn anything from those epidemics?
I think what we learn from it is that it tells you a lot about privilege within societies and who gets priority in terms of attention and focus. So Ebola is still an active problem, but it's in places and with people who are not high profile on a global scale and don't have access to resources that would allow for them to get well in the way that they deserve to be. If you look at HIV and the beginnings of the HIV pandemic, again, it was in groups of people who are marginalised in society, and that led to delays in terms of responses and ongoing stigma. So what we have learnt throughout COVID is that if you have a condition that affects people and that there's a concerted response and a targeted response, we can do incredible things and extraordinary things. And if we don't, there will be people who will suffer greatly as a result of that. And really the biggest learning is that it's that eternal vigilance, that we will need to be mindful that this is just a moment in time, and that we'll need to be really judicious and remain vigilant for the future. And that's the short term, medium term and long term as well. And I guess that's the reflection of what we've learned from Ebola and HIV, is that you have to keep going and you need to focus on people who need extra assistance and extra support.
Yeah, and on that, the Prime Minister has announced another, I think, $50 million today or yesterday in relation to giving access to our region and supporting some of the Pacific countries in terms of actually making sure they've got access to it.
Last word, Corinne. It's interesting that debate that Jenny and Mary Lou were having about certainty and milestones versus the comment that Mary Lou made that we've heard a lot, which is there is no certainty. I guess, what did you learn from the Victorian experience about, being really clear about milestones in the here and now, and the milestones in the here and now of vaccination?
Yes. It is. It's about vaccination. And I know, and it's purely anecdotal. I'm not Ipsos or Galaxy. I'm not running polls. But I know from my friends who live in Victoria, for them, the fury around this lockdown has been about a failure in quarantine and a failure for the vaccine rollout to have happened. And rightly or wrongly, that's the way people are perceiving it, that this lockdown in Victoria was needless. If we had quarantine working properly and we had the vaccine rollout working properly, then this wouldn't have happened.
Well, Can I just say my anecdotal evidence is from my 19-year-old nephew and godson who had his 18th birthday in lockdown, had the 19th. His fury is about the actual way it's been managed in terms of the government, in terms of the way
All right, I will have to get a final comment on that. Kudzai, from a medical point of view, the handling of this, was this lockdown necessary? We've only got a short time.
I think if you look at the numbers and also the degree of, I guess, uncertainty there was around this particular variant and how quickly it was likely to spread, you have to trust the projections. And I think any time public health get a signal that things could get very bad quickly, the right thing to do is to intervene early rather than wait for the worst to happen.
Yeah. OK, thank you all so much. Wonderful discussion tonight. Thanks so much to our panellists, and Julia is in tomorrow night. Good night to you.
Is this the queue for coffee?
Sorry?
Is this the queue for coffee?
No, it's the queue for vaccination.
Sorry, did you just say this is the queue for vaccinations?
Yeah. What do you think it was?
Well, it's Melbourne. I saw a queue, so I got in line.
How long have you been waiting?
5 hours.
Sorry, you've been waiting for 5 hours in a queue and you don't know what for?
Yes, and I'm nearly there.
Hey, don't worry. You got this.
Yeah, thanks. People keep telling me that.
I'm Dave, by the way.
Oh, Nick, hi.
Oh, you can't shake hands. There's a pandemic.
Yeah, mate, in India.
Oh, India. Can't wait to travel again.
Well, you better get vaccinated first.
Yeah? Where do I do that?
Here. That's what we're in line for.
Yes, right. Sorry.
I thought it was for coffee, but he said it's not.
Sorry, mate. You really should be wearing a face mask outside.
Oh, sorry. I didn't realise the fun police were in town.
No, the real police are in town. There's a $200 fine.
Fine. Fine. Next they'll be telling us we can't leave the house.